Hi, this is Dr. Karen Becker, and today we're going to discuss autoimmune hemolytic anemia. Autoimmune hemolytic anemia is abbreviated AIHA. It's also called immune-mediated hemolytic anemia, IMHA. This is a potentially life-threatening disease in which an animal's immune system destroys its own red blood cells. Antibodies produced by the immune system to fight pathogens instead target the body's own red blood cells and destroy them. Red blood cells are necessary to carry oxygen to the tissues of the body, and animals cannot survive without adequate oxygenation of all of their tissues. AIHA may be a primary or secondary disease. If it is a primary disease, that means there's no underlying cause that can be identified. Primary autoimmune disease is rare in cats. In secondary autoimmune disease, the immune system produces red blood cell antibodies in response to an underlying chronic condition such as cancer, chronic inflammatory disease, a drug reaction, or exposure to an infectious agent. Newborns can actually acquire this disease from their mother's first milk, which is colostrum, although this is pretty rare. The surface of the red blood cells becomes altered by an underlying disease process or a toxin. These alterations catch the attention of the immune system, which sees them as a foreign invader or a foreign pathogen. The immune system targets the altered red blood cells and destroys them through a process known as hemolysis, and either within their red blood cell vessels, or they can be destroyed or demolished when they go through the circulation system through the spleen and liver. Some of the known underlying triggers for secondary autoimmune disease are infectious agents like leptospirosis, Babesia, Ehrlichia, and the feline leukemia virus. Heartworm disease, IBD, as well as certain drugs like the sulfa drugs, heparin, quinidine, and hypersensitivity reactions such as reactions to bee stings, as well as vaccines, can all overstimulate the immune system. According to the traditional veterinary community, there's been no statistical significance in terms of association proven between vaccines and autoimmune hemolytic anemia. And they're only willing to consider a link if the onset was within 4 weeks of vaccination. Now, those of us that are holistic veterinarians absolutely believe that there is a much more direct and prevalent link between vaccines and autoimmune hemolytic anemia. When I worked as a holistic veterinarian in a large traditional vaccine clinic, I saw a lot of cases of autoimmune hemolytic anemia. I saw 1 to 2 cases a month. However, I have not seen a single case of this particular condition in my own clients' pets that have ever developed this condition in the last 11 years in private practice. I believe this is probably because in my current practice, which I own, we're titering in place of automatically giving traditional adjuvanted vaccines. The cases of autoimmune hemolytic anemia that I do see now are referred in from other traditional clinics that are probably continuing to over-vaccinate. Autoimmune hemolytic anemia is a life-threatening condition. It is absolutely more common in dogs than in cats. When it does occur in cats, it usually happens when kitties are young, and there is a known breed disposition in the sense that the Somali kitty is more predisposed to this. The disease can occur in dogs in all breeds, both sexes, and at any age. But studies have suggested that autoimmune disease is more prevalent in middle-aged spayed female dogs. And there may be a risk of acquiring the disease more commonly in May and June. Now, holistic veterinarians would correlate this to early spring vaccines. But certainly traditional veterinarians would argue that this has nothing to do with a seasonal correlation. Breeds that seem predisposed to autoimmune hemolytic anemia include the Cocker Spaniel, Miniature Poodle, Irish Setter, and the Old English Sheepdog. The symptoms of autoimmune hemolytic anemia are similar to other types of anemia and can include loss of appetite, vomiting, excessive thirst or urination, lack of energy, animals that tire easily, weakness, rapid breathing, pale gums, a yellow tinge to the gums and whites of the eyes, dark-colored urine, bloody stool, or dark tarry feces. Jaundice, which is the yellowing tinge around the gums and eye tissues, happens when the liver can't efficiently process bilirubin. Bilirubin is the yellow byproduct, which is a pigment that is the end product of a breakdown of red blood cells. A healthy liver can process the byproducts of red blood cells as they reach the end of their normal lifespan. But in an animal with autoimmune hemolytic anemia, the liver can't keep up with the amount of bilirubin produced by the immune system's destruction of the red blood cells. This is why pets with autoimmune hemolytic anemia have a yellow discoloration of the mucous membranes, which is especially noticeable in the gums and eyes. You can also sometimes see it on the inside of the ear flaps of both dogs and cats. Other symptoms vets look for are an enlarged liver, an enlarged spleen, enlarged lymph nodes, and potentially an intermittent heart murmur. A diagnosis of autoimmune hemolytic anemia can't be made until other causes of anemia have been ruled out. Unfortunately, this means a number of diagnostic tests will be necessary for a definitive diagnosis. Your vet will take a complete history and perform a medical examination. Diagnostic tests will include a complete blood count, a serum biochemical profile, and a urinalysis. A packed cell volume, or PCV, is a simple and fast test to determine the red blood cell quantity. Testing for reticulocyte count will show if there's enough new red blood cells being currently produced. And a saline agglutination test may show if the red blood cells are clumping normally. Other tests may include tests for infectious diseases and parasites, a Coombs test that looks for an immune system reaction going on in the bloodstream, or a flow cytometry test. X-rays and ultrasounds are sometimes ordered to rule out evidence of cancer or metastatic disease. That's cancer that has spread somewhere else that can be visible on X-rays or ultrasound. If your cat is suspected of having anemia, tests for feline leukemia and FIV may be needed to check for an underlying cause of the anemia condition. Conventional treatment for autoimmune hemolytic anemia is usually aggressive. The goal is to stop the destruction of the red blood cells so they can regain their ability to efficiently move oxygen to all the body's tissues. If there is any known underlying condition contributing to the destruction of red blood cells, these must be addressed, and the animal's health must be supported until their red blood cell supply is back to normal. If the disease is life-threatening at the time of diagnosis, the pet may need blood transfusions immediately. This can be risky because while the immune system is still attacking the red blood cells, an increase in the number of them through transfusion can trigger an even more aggressive immune system response. Sometimes a blood substitute, which is called oxyglobin, is used. This is a substance that has the ability to carry oxygen to all of your pet's body's tissues and potentially avoid the risks associated with transfusing real pet blood to your dog or cat. Drug therapy is also typically introduced in the form of a corticosteroid like prednisone to intentionally suppress the immune system so it will slow down or stop attacking the red blood cells. These drugs are usually given in very high doses, and if the animal's response isn't sufficient, even stronger immunosuppressants are administered, including chemotherapeutic agents. Needless to say, all of these drugs have pretty significant side effects, and some of them are quite serious. Some minor success has been seen with the use of intravenous immunoglobulins, which come from human blood. In rare instances, usually only in specialty veterinary hospitals, a process called plasmapheresis, which removes the antibodies from the blood, is also used. Sometimes a splenectomy is performed, and supportive care for autoimmune hemolytic anemia is really critical, and that can include recurrent transfusions, nursing support, aggressive hospitalization, medications, and IV fluids that are all necessary to keep the animal as hydrated and healthy as possible. Holistic veterinarians offer some adjunctive therapies while the initial crisis is being treated. The Chinese herb Yunnan Payao has been proven to effectively reduce bleeding anywhere in the body. Homeopathic phosphorus can also be very beneficial in this condition, as can the traditional Chinese medicinal formula Qingying Tang. Most animals with autoimmune hemolytic anemia unfortunately require long-term or even intermittent lifetime therapy because unfortunately relapses are really common. It's critical, in my opinion, that these animals' immune systems never be unnecessarily stimulated again by any type of vaccines.